Right. Hi, everyone. Thank you so much for coming. I'm very excited to be here today, and I'm excited to tell you more about robotics in nursing. To start, I want to show you how much robotics has developed in the last 10 years. This is a picture from a Tesla factory from 10 years ago. And in this picture, you can see how these robotic arms designed for assembling cars. These robot arms can do the task safely, efficiently, and quickly. Actually, these robot arms can do the task more safely than a human worker, which is great. However, these robot arms are not designed to work with humans. They are designed to work with other robots. And I want you to take a closer look and raise your hand if you can spot the humans in this picture. I'll give you a few more seconds. Thank you. So the humans are here. There are actually 3 of them. There is 1 in the middle and 2 in the back. So it might be difficult to spot the humans right away because the humans are such a small part of this task. However, today we are at a turning point. The new kind of robots are human safe, and they work in the same space as humans. So here are some examples of those robots that work in the same space as humans. So in the top left corner, that is a security robot. You might have seen these type of robots patrolling in hospitals, shopping malls, and airports. In this particular picture, this is a New York subway station. And to the right of that picture, it's probably one of the most commercially successful robots, the Roomba. And the 2 examples on the bottom are both delivery robots. The one on the left is a delivering robot delivering dishes in a hospital, in a restaurant. And the one on the right are delivering robots delivering food orders. This is actually a picture from the University of Houston. So with all these exciting advancements and developments in robotics, a few years ago, when I was still a PhD student at Rice, a team of us got together, and we thought, can we probably bring robotics into nursing? We had a hunch. We thought this would be a great opportunity, but we are not entirely sure where to start. The field of nursing seems to be very broad, and there seems to be a lot of tasks where robots could contribute, but we're not sure where we could start. So today I want to invite you to do a thought experiment with me. So let's say that you are in a leadership role in a hospital, and you want to explore how to bring robots into nursing practice. And I want you to think about what are some ways that you think robots could contribute to in nursing. And I have the examples of the robots from the previous slide on the bottom as a starting point. And when you are ready, you can scan this QR code and submit your answer here. I'm really just looking for short answers, like a few words like food delivery, security, or short sentences like supporting nurses in patient's room. So I'm going to transition to the web browser where I can show you the responses that have already been submitted. And the QR code will remain on the screen, and you are welcome to continue to submit your responses. All right, we have 24 responses so far. Here is the word cloud. I'll go to the responses. Acting as patients. Oh, that's guiding. Ooh, OK, maybe I'll go back to the word cloud. So here, we see patients, nurse, vital, patient sitters, food delivery tools, probably delivering tools, supplies, delivering supplies for nurses, helping with administration. I think these are really good ideas. And hopefully with this activity and exercise, you can see how there are so many ideas and a lot of opportunities where we can bring robots into nursing. All right, thank you so much for doing this exercise with me. So our team, our first thought is that we want to bring robots into a patient's room and to support nurses in the patient's room. We realized that a lot of the patients' requests were mundane tasks. So for example, bringing the TV remote, bringing the cup of water. These tasks did not require much expert nursing knowledge. So if we could use a robot to support these tasks, then that would allow the nurses to focus their time on tasks that require the expert nursing knowledge. So we built a simulator. You can see in the simulated environment, this is a patient room. There is a patient bed. There is the cabinets, and there is a bedside table. And we also built a graphical user interface. That is the window on the On the left side, that is where how the patient could send a command through the graphical user interface to the robot, and the robot could move the items around in the patient's room. And I want to highlight Carlos' contribution to this particular project. Carlos was a PhD student with Dr. Lydia Kavraki, and he became a research scientist at Houston Methodist. So this was a really great first step for us to explore how we can bring robotics into nursing. But we quickly realized that bringing a robot into the actual patient's room is going to be very challenging. First, the patient's room, as you can see, it's a very clustered environment. There are a lot of machines going on, and there are people moving around all the time as well. So bringing this robot into this environment is going to be very difficult technically. And another issue is that all the patients' rooms look different. And actually, none of the patient's room looks like the simulation we built. The simulation we built was really, really simple. And also, on the non-technical side, we also need to pay attention to protecting patients' privacy, protecting patients' medical records, and protecting the safety of everyone involved in the situation. So we thought, can we find a more controllable environment where things are more controllable, the layout stays more consistent, and can we find an environment where things are lower risk, so we don't risk hurting anyone in the room? And we found the answer. The answer is nursing education. So in the classroom and in the simulation labs, in those settings, the things are more controllable, and there is not an actual patient in the room, so it's lower risk. And personally, I had a background in education technology where I build AI tutors to help students learn. So we thought, can we build robotic tutors for nursing education, for clinical nursing education? And the two questions we needed to answer are first, what are we going to teach? What are the robotic tutors going to teach? And the second question is why? Why do we even need robotic tutors? What values are robotic tutors going to bring that human educators cannot provide already? First, let's look at the why question. So we know that nurses are an essential part of our healthcare system. However, the world is experiencing a dire nursing shortage. According to the WHO, the world needs 4.5 million more nurses trained and onboarded by 2030. As a result, hospitals need effective and scalable programs for training and onboarding nurses. The current way for training new nurses is through this nurse-to-nurse model, where an expert nurse or nursing educator trains new nurses. Most of the time in a big classroom learning. And this model is very effective. It reduced healthcare-associated infections and improved patient care outcome. However, this model is not ideal because novice nurses actually learn better when they are paired up with an expert nurse. And they can learn from the expert nurse through this one-on-one hands-on opportunities. However, given the current nursing shortage and the fact that experienced nurses are already very busy with their patients, the current model cannot provide this one-on-one training opportunities. And our key insight is that robots can help fill these gaps. Robots can serve as teaching assistants and tutors to help novice nurses practice skills even when the human experts are not available. And today I'm very excited to share one of our accomplished work with you, Astrid, which is a robotic tutor for nursing education. And Astrid was developed through a 2-year co-design process that first started with understanding the needs of nurses. And during this time, I attended nursing classes to see how human educators teach. I followed nurses around on hospital floors to see how they interact and how they take care of their patients. And I also met with different stakeholders to really understand the needs from different perspectives. And during the same time, we developed several prototypes to really conceptualize this idea of a robotic tutor for clinical nursing education. And this was an iterative process where we had nurses coming in, they test out our prototypes, and so we can get some feedback and improve our prototypes. And when we were finally happy with one version of our prototype, we conducted a formal feasibility study. So the system I'm going to focus on during today's talk is the system used in our feasibility study. The goal of the tutoring system is to help nurses reduce chances of healthcare-associated infections. So healthcare-associated infections refers to an infection that occurs while the patient is receiving healthcare, for example, during a surgery. In worst scenario, patients could die from healthcare-associated infections. And unfortunately, the mortality rate for bloodstream-associated infections is very high. However, most of the healthcare-associated infections are actually preventable through proper practices. So here I have 4 types of non-compliant behaviors that could increase the chances of healthcare-associated infections. So let's look at examples. So I'll use the one on the bottom left as an example. So often we see nurses like keeping their hands like above here, where they do this praying pose. That is because like they want to make sure their hands are not touching anything non-sterile. So if they drop their hands below the waistline, then it's more likely that they touch something non-sterile. And I want to show you an example in action. I want to show you how subtle these non-compliant behaviors could happen. So this is a nurse with over 16 years of experience, and this nurse is working on a patient, working on a particular nursing procedure on this patient. The patient is represented by this cutting board mannequin on the table. So let's see if we can spot the mistake. So basically in the example that you would see, the nurses drop their hands below the waistline twice when they try to toss the waist. And this could happen really, really quickly. It's just like a split second. They drop this item, and then their hands got too close to the trash can. And we know that the trash can is non-sterile, and then there are a lot of items that are non-sterile. So the first feature of Astrid is that Astrid observed the nurse while the nurse practiced a procedure, and Astrid can detect if the nurse had made a mistake. So specifically, if the nurse had made a non-compliant behavior. And if Astrid noticed a mistake, then Astrid will let the nurse know right away. And this is accomplished through this system architecture design. It starts with the RGB depth camera. So I am on the first box on the left here. So this is a camera that we put in front of the nurse, and this is the camera that captures the entire environment of the simulation lab. And then this information is sent to a post-estimation module. So this is the module where we can estimate the joint positions of the nurse. So the little red dots you see in the image, those are the estimated joint positions. And then this information is sent to a compliance detection module. So this is where we combine both the nurse behavior information and the environment information together. So we already have the post information from the previous module. And we also want to see where's the table, where's the patient, where's the stereo field, so we can determine whether the nurse has made a mistake or not. And if the system detects that the nurse has made a mistake, the system will let the nurse know right away by giving them a task time warning. So this is what we call the real-time feedback. So the system will let the nurse know what they have done wrong. And after the nurse performs the entire procedure, the system will also provide them with a summary feedback. And this is what we call the post-practice feedback. Here I have an example of what would be included in the post-practice summary. So first, it will tell the nurse what mistakes they have done and how many times they have done each of the mistakes. We also provide the nurses with the particular snapshots of when the mistake happened. So rather than going through the entire recording of the procedure, the nurses would see right away the moment when they made a mistake. The second feature of Astrid is that Astrid simulates a curriculum of nursing scenarios that could happen in the real world. And I developed this feature because through my interviews with nurses and particularly nursing students and novice nurses, they mentioned that the biggest challenge they face is this gap between classroom learning, where everything is perfect, and the real-life practices when so many things could happen. So in the real life, the patients could be talking to the nurses. The patient's family could be asking the nurse a question, and they want the nurse to address right away, and the nurse gets distracted. Or there could be other unexpected situation arises. So in this video demo, we are going to see that the nurse is working on a procedure on the patient. Again, the patient is this cutting board mannequin on the table. And an unexpected situation arises that forces the nurse to stop what she is working on and to take actions in response to this emergency right away. There is going to be sound in this video. Let's take a look.
Your patient's blood sugar is dropping below 54 milligrams per deciliter. I am bringing glucose. Your patient's blood sugar is dropping below 54 milligrams per deciliter. I am bringing glucose. Your patient's blood sugar is dropping below 54 milligrams per deciliter. I am bringing glucose.
I'm just going to use this to cover this for now, and I'll start over. Warning, reaching across the
Please take
scale.
the glucose and give it to the patient. Please take the glucose and give it to the patient. Please take the glucose and give it to the patient.
So in this scenario, we saw that Astrid gave the nurse a warning saying that the nurse was reaching across the stereo field. So what happened there is that the arm part of the nurse, this part is non-stereo. So by having this part on top of the patient's insertion side, we risk introducing infection to the nurse. So a better way to grab the glucose would be to go around the patient and grab the glucose from the side. To evaluate our system, we conducted a formal feasibility study. And during the study, we worked with 9 nurses. So 7 of them are novice nurses with less than 2 years of experiences, and 2 of them are experienced nurses. So we believe the system would benefit novice nurses and nursing students more than experienced nurses, but it's also important for us to include these 2 experienced nurses because these 2 experienced nurses participated throughout the co-design process, and it was important to invite them back and show them how much Astrid has developed and have their input. During the experiment, each of the nurses worked on 4 nursing tasks, and during each task, they experienced the different real-life scenarios. We looked at 2 types of measurements. First is the objective measurement. So this is to look at how well Astrid could detect the non-compliant behaviors. And in order to get the ground truth of this data, we worked with 2 nursing experts to annotate the recordings of nurses interacting and using Astrid. And then we'll compare the robot data with the expert data. And the second type of measurements we collected include subjective measurements. Particularly, we want to see how useful the participants found Astrid to be. So in the future, when we implement this in nursing schools and in hospitals, how useful the users would find this system to be. And we also wanted to see how engaging their experience interacting with Astrid was. So first, let's look at the objective measurements. Here we report a high accuracy of 98.6%, a precision of 95.5%, a recall of 83.5%, and that gave us an F1 score of 0.89. So the F1 score is the score that measures how good a system is. The score takes on the values from 0 to 1. So if the score is between 0.9 and 1, this is considered excellent. And for the score between 0.8 and 0.9, this is still considered very good. So here we see that Astrid, as a very, very new system, to have an F1 score of 0.89, this is very promising results. And next, we want to see how useful the participants perceived Astrid to be. Here we used this scale called the perceived usefulness of information technology. This is a survey that evaluates how useful a new piece of technology would be in the future. And this survey included statements such as, using this technology would improve my overall job performance. And participants had to evaluate each of these statements on the scale from 1 to 5. So 1 means that they believe the scenarios described in these statements will be extremely unlikely to happen. And 5 means that they believe these scenarios would be extremely likely to happen. Here we obtained a mean score of 4.7 and a standard deviation of 0.4. And next, we used this scale called the user engagement scale to see how engaging the system was. This scale included statements such as, my experience was rewarding. The participants also had to rate each of the statements on a scale from 1 to 5. So 1 means they strongly disagree with the statement, and 5 means they strongly agree with the statement. So here we obtained a mean score of 4.8 and a standard deviation of 0.3. And I want to share one of a very powerful quotes from one of the participants who said, I always feel very anxious because I am new to the job, but practicing with the robot has already made me feel better about my skills because now I know I did not make any mistakes. I also like the real life scenarios. We did not see those in nursing school. So overall, we see very positive, both subjective and objective measurements from our user studies. However, this is only the first version of Astrid. Our team is working hard and to improve the limitations and enhancing the system. So for the next 5 to 10 minutes, I want to highlight 3 limitations of the current version of the system and report to you what we have done and how we are improving these limitations. So the first limitation is that Astrid only used a rule-based compliance detection. Specifically, we focused on these 4 rules associated with the stereo techniques. However, nursing tasks include more than just the stereo techniques. So as an example, this is a 2-page checklist of a procedure called the centralized dressing change procedure. So if you look closer, you will see that the stereo techniques are only a 1 line at the very bottom of this checklist. It asks, did the nurse maintain stereo techniques throughout the dressing change, yes or no? And the rest of this checklist include over 30 steps that involved in this procedure. And our goal is to also be able to evaluate each of these other individual steps. And our proposed solution is that if we have a video recording of a task, then first we want to do video segmentation based on the checklist that we receive from the hospital. Then for each of the steps, we can provide a score. And this project is led by my PhD student, Wumi. She is in the audience. You can say hi to the audience. And please, if you are interested in this project, you can go talk to her. She is my first PhD student, so y'all be nice to her. The second limitation is that Astrid provided generic feedback to all the users, but we know from education that people learn better when they receive personalized tutoring and personalized instructions. In order for the robotic tutor to provide personalized instructions, we can adapt this framework called interactive teaching. The idea here is that the robot teacher could be asking the students some questions, and based on the students' response, we can evaluate their prior knowledge as well as their current understanding. And then from the estimated current understanding, the robotic teacher can provide personalized instructions. And this is part of my PhD work and my PhD thesis. I would be happy to talk more about this after the talk. And the third limitation here is that we only tested the system in this fixed environment. So in this particular environment, we put a camera in front of the nurse. This was the best angle we could find during the experiment. But even in this angle, you can see that half of the nurse body is blocked by the table. So we want to know, can we find a better angle? And what if the nurse is moving around in the room? How can we still make sure that we can follow the nurse and still monitor their behavior? And the idea here is to put the camera on a mobile robot and have the robot move around in the room so we can find a better angle. This project is led by Qingxu. Qingxu, you can wave. That's Qingxu. If you have any questions, please go talk to Qingxu. This is a really amazing work that he's doing. I will show a video demo here. So in this simulated environment, we see the robot on the left side of the room, and the goal of the robot is to move to the right side of the room. And while the robot moves to the other side of the room, we still want to make sure the robot is monitoring the nurse. So here, by monitoring the nurse, we are going to define that by monitoring the nurse face. So using robotic motion planning, we can find 2 paths. One is the one on the left, that's the red path. It goes behind the nurses, and the one on the right goes in front of the nurse and the patient. So the traditional method would pick the red path, where the robot goes behind the nurse, and that is because this path is a shorter path. Here from the camera view, we can see that we are no longer monitoring the nurse face when we choose this shorter path. And Qingxu's method would allow the robot to prioritize monitoring the nurses. So here the robot takes the longer path, but we can see that the robot can see the nurses better. And sometimes the robot can get a little too close, and I believe Qingxu is working on that now. So Qingxi's method improves face detection by over 2 times. And next, I'm going to move on to an example where we see the method this method implemented on the physical robot. So in this environment, we can see the robot is starting at point A. So point A, this is where the starting point of the robot. And the robot's goal is to pick up one of the 2 boxes, either at goal 1 or goal 2. And in the meantime, the robot wants to monitor the nurse. In this example, we're going to see that the nurse actually is moving around and the nurse changes the direction where they are facing. So in order to continue to see the nurse face, the robot might need to change which toolbox that is going to. And in this example, we can see that there are also some obstacles in the room. There's the trash can, there's a chair. So while the robot moves around, the robot needs to avoid those obstacles. All right, here, so first the robot tries to go to the toolbox on the right side because that's a closer toolbox. And then here we saw that the nurse just changed the direction that they are facing. And then the nurse changed the direction that they're facing again. And here from the camera view, we can see that while the robot moves around, we can still see the nurse face. All right, so that summarizes my talk. Thank you so much for giving me this opportunity to share Astrid with you. Sorry, I guess I said thank you a little too early. I just want to conclude that Astrid was a robotic tutor, the first of its kind robotic tutor for nursing education, and it was developed through a co-year co-design process with nurses, nursing students, and nursing educators. Currently, we are working on improving the systems through advances in perception, planning, and human-robot interaction. And finally, we would love to invite you to work on this new, exciting, and impactful domain. Thank you.
Take one question or maybe 1 or 2 questions from the audience before we get started with our panel. Okay, we have one question at the back. We'll start there.
Hi, thank you for the talk. I was wondering if the questions that you're designing for the nurses to learn can be sort of too easy. Like it's like a training and testing, sort of like when we were entering grad school, there were some questions and you could answer the quiz by just memorizing and redoing it. Is that a problem that you could see with this type of training?
Yeah, so the question is, here we're focusing on the stereo techniques, the question is whether that is too easy for students to learn. So actually it's not. In the hospital, I see a head here, it's probably not from the clinical perspective. And this happens a lot, even like these days, like the video I couldn't play, that was a nurse with 16 years of experience. And they might have like bad habits, so a lot of these stereo techniques are broken pretty often.
All right, maybe one more question.
I was just going to ask a question about sort of this transition from sort of rule-based to more personalized, and can you talk about the role of, I don't know, things like embeddings or probabilistic analysis in that? Or how do you approach this?
Yes, so I think there are 2 parts with this question. First is, where does the personalization come in, and also how can we embed probabilistic methods with this part? So let me give you an example. So we saw this checklist of a nursing procedure. So there is specific steps, like step 1, you're supposed to do something, step 2, you're supposed to do something. But people don't follow that steps all the time. Most of the time, they have their own preference, or maybe they forgot one step, so they realize and then they try to do that again. So the first part of personalization comes from this planning part. So what is the nurse plan? Everyone has a different plan for doing the task. in comparison to the right way to do this. So if we can predict, if we can, by observing what the nurse is working on and realize what they are doing wrong, we can provide this personalized feedback. And I think that part has a lot of probabilistic methods in there, because when we are looking at these possible ways to complete a task, there are maybe like 10 or 100 ways. So which method, which plan has a higher chance of probability being the one that the nurse is implementing? I think that's one part where probabilistic methods could come in. Yeah.
Okay, thank you very much again for your talk. Please join me in thanking again Professor Qian.